Assalamualaikum and very good day to my lecturers, Dr. Ellis. My name is Muhammad Rafizi bin Amir. My matrix ID is 2018 499398. So, today I want to give persuasive speech, and my topic is about stop smoking. So guys, do you know what is different about smoking and vaping? Let me tell you first. So, for smoking is tobacco. Smoking is the practice of burning tobacco and intesting the smoke that is produced. The smoke may be inhaled as is done with cigarettes, or simplified, released from the mouth as is generally done with pipe and cigars. So for the vaping is the inhaling of vapor created by an electronic cigarette, or what we call is e-cigarette, and is common among teens. For example, vaping, nowadays teenagers are more likely to follow the latest trends because vape has become big phenomena to quit smoking even among teenagers who do not smoke cigarettes or vaping. So guys, for the next is effect smoking to health. I choose 5 main points to know and must be know that smoking is very bad health. The first one is cancer. Tobacco is a leading cause of cancer and of death from cancer. People who use tobacco products or who are regularly around environmental tobacco smoke, also called second-hand smoke, have an increased risk of cancer because tobacco products and second-hand smoke have many chemicals that damage DNA. Second, tobacco use causes many types of cancer, including cancer of lungs, voice box, stomach, pancreas, cervix, and acute leukemia. People who use smokeless tobacco have increased risk of cancer of the mouth, esophagus, and pancreas. There is no safe level to tobacco use. People who use any type of tobacco products are strongly urged to quit. People who quit smoking, regardless of their age, have substantial gains in lifestyle compared with those who continue to smoke. Also, quitting smoking at the time of a cancer diagnosis reduces the risk of death. The second is heart disease, stroke, and blood circulation problems. So, for the stroke is a loss of a brain function caused when blood flow within the brain is interrupted. Strokes can cause permanent brain damage and death. Smoking increases the risk of strokes. Deaths from strokes are more likely among smokers than among former smokers or people who have never smoked. So the third is diabetes. We know that the smoking is one of cause of 2 types diabetes. In fact, people who smoke cigarettes are 30 until 40% are more likely to develop types 2 diabetes than people who don't smoke. People with diabetes who smoke are more likely than those who don't smoke to have trouble with insulin dosing and with managing their condition. 4 is infection. Tobacco smoke exposure increases susceptibility to respiratory tract infections, including TB and Legionella disease, bacterial vaginosis, and sexual transmitted disease such as chlamydia and gonorrhea. So the last is dental problems. Smoking can impact your oral health. People who smoke are at higher risk of developing mouth cancer, gum problems, losing teeth, decay on the roots of teeth, and complication after tooth removal and gum and oral sugary. So the last is how to stop smoking. Number one is eat healthy food. Number two is drink more water. Number three is do not carry cigarettes. Number four is exercise regularly. Number five, make a quit plan. Number six, save more money. So for the number one is eat healthy food. We can take fruits and vegetables, ginseng tea, milk and dairy, and the last is sugar-free gum and mints. What is fruits and vegetables? Cigarettes blocks the absorption of important nutrients such as calcium, vitamin C and D. For example, smoking just one cigarette drains the body of 25 mg of vitamin C. Incorporate more fruits and vegetables into your diet will restore these nutrients and make help with reducing cravings to smoke. And number two is ginseng tea. Drinking ginseng tea could reduce the appeal of smoking and make it less enjoyable. And number three, milk and dairy. Smokers have reported that drinking milk made cigarettes less worse. Most smokers said that it gave their cigarettes a bitter aftertaste. And the last is sugar-free gum and mints. Plus, both gum and mints last a long time, typical longer than it does to smoke a cigarette. Drinking more water. Staying hydrated is the key to leading a healthy life, and sipping water throughout the day can help you quit smoking naturally. Water helps flush toxins from the body, so water is necessary to remove toxic ingredients of cigarettes. So number four is exercise regularly. Exercise has a range of positive effects which include increased lung capacity, a healthier heart, lower blood pressure, and overall sense of well-being. Smoking does the opposite of all this, so it is hard to imagine why anyone would negate these positive effects. But humans being act in a variety of ways which are difficult to perform. Number five is make a quick plan. Some smokers prefer to dive right in and just start quitting. We recommend intentionally setting a date to quit smoking. Big changes in life benefit from good planning. Take a look your calendar and be strategic about when it would be a good time to quit. Consider quitting on a day without too many temptation or stress like a looming work deadline. So, the last is save more money. You might be pay more for health related costs. If the price of cigarettes was reasonable, think about all the health costs involved you smoke. Because his true smoking hurts almost every organ in your body. At this point, you probably know about the damage of your lung, but it also affects your heart, eyes, ears, stomach, and more. So another example, you might have to buy more clothes and furniture as well. The smell of smoke can sink into the fabric of your clothing as well as furniture, carpets, and drapers. This third-hand smoke also means there are toxic chemicals lingering on the surface. Thus, you may want to need or to replace your furniture, decor, and clothing regularly, which can seriously add up depending on your taste. Plus, if you don't want the odor, you might start going to the dry cleaning regularly. That's all from me. Thank you.